All right, then. Well, Gauteng continues, of course, to record those high numbers of new COVID-19 infections. Government has obviously announced tighter restrictions, but are they enough to curb the spread of the virus? Let's join in on this conversation with Professor Barry Schoub, who's a virologist, an expert in this field, just to get a sense of where he's at with this decision by government. Prof, good to have you, and good morning to you. Earlier on, my colleague Gareth had a conversation with Dr. Angelique Kutsia, who actually reiterated that it seems the measures, according to her and her organization, were not enough to assist in curbing these numbers. She feels that more could have been done from the beginning, as far back as when the national state of disaster was first announced to date. Where do you stand, and are you satisfied with where we are in terms of the decisions around the levels and lockdown regulations and the measures there?
Yes, good morning to you and good morning to the viewers. I think we could have had tighter restrictions. We're now really kind of basically similar to what we had in the first wave. In fact, we're now exceeding the first wave, particularly in Gauteng. We're kind of way ahead of the first wave. Then we had lockdown. And the problem is, of course, people are now having COVID fatigue. We're now into our second year of COVID. People are not really enough. We don't have any outside restrictions, outside legislation to kind of curb people's behaviour. We're not going to get on top of this. But at the moment, of course, we don't have enough vaccine cover, so we're relying on people's behaviour to basically stop the transmission of the virus. And in order to do that, we have to go above what we can trust people to do. We need to have some restrictions. I think we need to have more than what has been announced. I agree.
In your opinion, Prof, I mean, in terms of the measurements and the lockdown, where do you think we should be right now? The President said we're on level 3. Is level 3 enough? Do you think we should have been at a much more stricter lockdown?
The problem is this, we can give medical advice and epidemiological advice, and that kind of, we can come from that quarter. The problem is there has to be a balancing act, because we need to have people's cooperation, we need to have people's buy-in to it. And, of course, we need to have the economic considerations. And we know that many of these restrictions cause a tremendous amount of hardship. Economic hardship, but also even medical hardship, because the other medical things also do suffer. People going for ongoing medical monitoring and antenatal and so on and so forth. So we need to balance our restrictions. But, I think we need to kind of think very, very kind of carefully what restrictions we can impose, which will have an effect on limiting the transmission of the virus, but at the same time not damaging too much the economy. And I think this is where it's a very careful, well-considered balancing act which needs to be instituted.
Yeah. And that balancing act definitely considered there in terms of lives and livelihoods. But you did mention that, there's a bit more reliance now on human behavior as well, because it does play a role. The virus does move. It moves when, people move. And if you don't comply with, the regulations in terms of wearing your mask and social distancing, you can spread COVID-19. Are you satisfied with South Africans' human behavior and how they carry themselves, Prof, during this pandemic, especially during this third wave?
To be quite honest, no. I don't think so. We go out in the streets and you see people congregating without masks, people sitting in restaurants laughing and joking, and without physical distance. And I think this is where, unfortunately, even if it was for a short period of time, even for a few weeks, to have a hard lockdown, I think that may well break this kind of cycle of transmission. I think, for example, gatherings, need to be much more strictly restricted. Restaurants and so on, even for a short period of time. I do understand the hardships, but I think if we had a temporary, hard restrictions, that could have quite a significant effect on the epidemiology of this virus, on the way that is spreading in the community.
You say you're disappointed so far in how South Africans have carried themselves, at least a majority of those who don't comply. Do you think they have a sense of the reality on the ground in as far as what medical and healthcare workers go through on a daily basis, what these facilities have to go through now that with Charlotte Maxeke having closed down, the pressure, of course, having been placed on other hospitals? Do you think there's a sort of understanding and appreciation of what really is the reality on the ground for medical experts here?
No, I think you hit the nail on the head. I think this is where the problem lies, because people don't see this. The majority of people I think just about everybody now knows people that have been infected, but most people that are infected are fairly mildly infected, like influenza, and they don't see the serious consequences, that kind of top of the iceberg, of the people that are in hospital. I don't want to be graphic, but people are gasping for breath and lonely. They don't have visitors. This is a terrible disease. And unfortunately, that doesn't come through to the population. And I think that people don't see that. And because they don't see that, they don't see the need for the restrictions, which are uncomfortable, which are imposing on your quality of life. And I think this is where the problem lies.
Prof, we have to leave it there. Thank you so much for your time. Virologist, Professor Barry Schoub joining us there and just expressing, of course, what needs to be done in as far as, of course, South Africans' responsibility and accountability is concerned, while, of course, government tries to balance this act.
I just was amazed by the last comment, just before you go to break, that a lot of South Africans with the coronavirus fatigue, right now it's an inconvenience for the majority of us, until we see a loved one literally gasping for air.
Yeah.
We're annoyed because we can't go see our friends.
You know what, it's actually interesting that you both mentioned that, because I remember right here on ENCA, we had that visual. I think it was in one of those makeshift sort of like, tents whereby government is trying to increase capacity because the hospitals are so full. They're trying to increase that outside. We literally had an image. I think it was in Nasrec, yeah. We saw an image of, literally doctors trying to pump life into one of the patients. I remember just thinking, my goodness, this is so graphic, but so necessary for us to see this at this point.